I do these, and when I feel like there's someone better, I'm going to point you in that direction. And I hope that other doctors are doing the same way, because that's the type of care that we want. All right, let's take a look at our last submitted question for today. How do you, as an orthopedic surgeon, help decide and prepare your patients who are needing to have surgery, even when the surgery may change their lives physically? And that's a really good question. I like that one.
So it's kind of the same thing we talked about. I mean, you have to address both sides of the question, right? You have to address or both sides of the patient. You got to address obviously the fear. I guess there's maybe three: fear, the pain, and expectations, right? And all those things have two components to them. They have the physical component and they have the mental component, right? So when we address them, the first thing I like to do with my patients is I give them sort of the expectations. So what you're expected to do on average. That's from a timeline recovery, pain recovery, and success recovery. Then I'll talk to them about, like what you're going to be at, right? And I don't go into too much detail about your mental stuff at that point, because every person's different, right? There's patients at 6 months that are doing really well and they just don't have a good mental attitude, which is not their fault. It's just the way their recovery is. And each person's wired differently. So that person needs less discussion of how their knee's doing and more discussion about how their head's doing. Some people come in and they say, my knee's doing really well, but I'm just worried about it. And those people need more like, okay, physically, you're doing really well. And then they get better, right? And there's a third type that maybe aren't doing as well physically. They need to focus on the physical and less on the mental. Like I'm telling them, you're doing well or you're mentally not there yet. Physically, let's figure out what's going on. Do you have another complication? So that's really how I manage it with the patients. But the biggest thing is consistency, honesty, and full explanations.